Hello everyone, it's Mo from Rophem NCLEX Academy. Let's talk about the step-by-step strategy to answer NGN questions. In my previous NGN video, we talked about how to answer NGN questions. In this video, we are going to apply the knowledge from that video to break down these NGN case studies in a simple step-by-step strategy so you can apply the same knowledge when you answer NGN questions. We have patient scenarios to discuss, and we are going to answer questions based on the 6 steps in the NGN clinical judgment. The NGN steps are thinking steps that test how well you can make clinical judgment. Don't forget what you are doing in each of the NGN steps. Step 1 is where you will recognize cues. You will identify relevant patient information that you need to make appropriate decisions. In step 2, you analyze cues. You will interpret the data you collected. In step 3, this is where you will prioritize hypotheses. You will determine the priority health problem, decide which patient needs are serious, most immediate, and why. In step 4, you will generate solutions. This is where you will determine appropriate nursing interventions to address the highest priority problem. You will take action in step 5. This is where you will implement the safest and most effective interventions in a timely manner. In step 6, you will evaluate outcomes. In this step, you will assess the patient's response to interventions and decide if you need to make any changes to the plan of care. This is our patient, 73-year-old, who has been admitted with dehydration. Our client has recent use of NSAID. He is alert and oriented ×3 and denies pain. Blood pressure is 88/54. Heart rate is 112. Urine output is 20 milliliters per hour. BUN is 48. Creatinine is 2.6 and potassium is 5.6. The first step is to recognize cues. So I want you to take a look at the patient information. Are there any data you are concerned about? Now look at this question. Which of the following findings are clinically significant? Select all that apply. Answer choice A, blood pressure of 88/54. B, urine output of 20 milliliters per hour. C, creatinine of 2.6. D, BUN of 48. E, R rate is 112. And F, alert and oriented ×3. Which of them are your choices? The correct answers are A, B, C, D, and E. Let's break it down. Hypotension is concerning as well as low urine output, and they are significant because there is poor renal perfusion. Elevated BUN and creatinine levels, these are abnormal, and they are telling us that something is wrong with the kidneys. Tachycardia is also significant in a client who is dehydrated. There is no problem with the patient being alert and oriented ×3, so answer choice F is not correct. In step 2 of the case study, we will analyze cues by answering this question. The nurse determines that the findings in step 1 indicate which of the following conditions. Answer choice A, chronic kidney disease. B, pre-renal acute kidney injury. C, intrarenal acute kidney injury. D, post-renal obstruction. And your choice is which one of them? The correct answer is B. Let's break it down. Based on the cues we recognized in step 1, hypotension and low urine output indicate there is poor renal perfusion. Elevated BUN and creatinine levels, this means there is impaired kidney function. Tachycardia is also very important because the client is dehydrated. We also know that from the case study, patient has recent use of NSAID. So when you put them all together, patient has dehydration, hypotension, and the use of NSAIDs. All of this together will lead to decreased renal perfusion. The result is pre-renal acute kidney injury. Chronic kidney disease is not correct. This patient doesn't have any data to support chronic kidney disease. Also, intrarenal acute kidney injury as well as post-renal obstruction, both of them are not indicated in this case study. Step 3 is where we prioritize hypothesis. Take a look at this question. Which complication is the priority to monitor? Answer choice A, metabolic alkalosis. B, hyperkalemia. C, hyponatremia. And D, hypercalcemia. What do you think about this one? The correct answer is B, and this is the rationale. Our analysis from NGN Step 2 indicates pre-renal acute kidney injury. Take a look at the urine output. It's decreased. Also pay attention to the potassium level. Patient is retaining potassium because the kidneys are not doing well and potassium excretion is decreased. And you know why this is important? It is important because hyperkalemia increases the risk of life-threatening cardiac dysrhythmias. The other answer choices are not correct. For the same case study, it is time to come up with specific actions needed to achieve the expected outcomes. This is NGN Step 4, and here is the question. Which interventions should the nurse anticipate? Select all that apply. Answer choice A, IV isotonic fluids. B, discontinue NSAIDs. C, strict intake and output. D, potassium restricted diet. And E, administer potassium supplements. Which of them are your choices? Correct answers are A, B, C, and D. Let's break it down. Isotonic IV fluid is needed to restore perfusion. Any medication that is toxic to the kidneys should be discontinued, so NSAIDs must be discontinued. Clients will need strict intake and output so we can monitor and follow up on urine output. To prevent hyperkalemia, client will need potassium-restricted diet, and this patient does not need potassium supplement. Answer choice E is not correct. In NGN Step 5, you will decide which nursing actions will directly address the most important priorities of care. This is the question. Which actions should the nurse perform first? Answer choice A, start IV normal saline. B, provide low potassium diet teaching. C, insert Foley catheter. D, administer Kxalate. Which one will you do first? Correct answer is A, start IV normal saline. This is the rationale. It is important to identify the cause of the problem because what we need to do here is to treat the cause. Client has dehydration. So the cause of this problem is hypoperfusion, basically decreased renal perfusion. So the first thing to do will be to start IV normal saline as ordered. In step 6, you will evaluate the outcomes by looking at the client's situation and ask if the actions you have taken helped to resolve the priority health problem. Take a look at this question. Which finding indicates improvement? Answer choice A, urine output increases to 40 milliliters per hour. B, creatinine increases to 3.1. C, potassium increases to 6.2. D, blood pressure remains 88/54. Which of them do you think indicate improvement based on this client scenario? Correct answer is A, urine output increases to 40 milliliters per hour. Let's break it down. Look at each answer choice and compare with the client's baseline numbers. Increased urine output from 20 milliliters per hour to 40 milliliters per hour is good, and it shows that our interventions worked. This is an improvement in the client's situation. Creatinine increased to 3.1, potassium of 6.2, and blood pressure remaining the same at 88/54. These are not signs of improvement. This is our next patient, 24-year-old female who arrives at the hospital complaining of dysuria, urinary frequency, urgency, and suprapubic discomfort for 2 days. Temperature is 99.3. Patient denies flank pain. Below is the urinalysis report. Cloudy urine, positive leukocyte esterase, positive nitrites, elevated WBC, bacteria positive. In NGN Step 1, we recognize cues. Remember, finding what matters. Take a look at this question. Which assessment findings are most concerning? Select all that apply. Answer choice A, dysuria. B, suprapubic discomfort. C, positive nitrites. D, flank pain. And E, urine protein negative. Which of them are your choices? Correct answers are A, B, and C. This is the rationale. Dysuria, suprapubic discomfort, and positive nitrites. All of these are specific signs and symptoms for cystitis. Patient denies flank pain, so D is not correct. Answer choice E is not correct also because negative urine protein means kidney function is good. The kidneys filter blood very well and large molecules are not leaking out into the urine. That's a good thing. In step 2 of the case study, we will analyze cues. And what we are going to do is to put the cues together. Here is the question we need to answer. The nurse should interpret these findings as consistent with which of the following? Answer choice A, pyelonephritis. B, glomerulonephritis. C, cystitis. And D, nephrotic syndrome. Which of them will you select? Correct answer is C, cystitis. This is the reason why patient symptoms are localized to the bladder without systemic infection. These symptoms indicate cystitis. Pyelonephritis in answer choice A is not correct. She also doesn't have chills and headache, which are signs and symptoms of pyelonephritis. Glomerulonephritis in answer choice B and nephrotic syndrome in answer choice D, both of them are not correct also because urine protein is negative and we don't have other information to confirm any of these two disorders. In step 3, we will prioritize hypothesis. That is, finding the priority health problem. So here is the question. What is the priority problem? Answer choice A, insufficient nutritional knowledge. B, hypothermia. C, impaired urinary elimination. And D, fluid volume deficit. Which of them do you think is correct? Correct answer is C, impaired urinary elimination. Here is the rationale. Primary issue in this case study is infection and inflammation, which is affecting urinary elimination. That's the reason she's having urgency, frequency, and dysuria. Hypothermia in answer choice B is not correct. Hypothermia is a temperature below 95 degrees. Patient temperature is 99.3. The other two answers are also not correct. Step 4 is where you will generate solutions. You will come up with solutions to the health problem identified previously. Which intervention is most appropriate? Answer choice A, give IV pain medication. B, encourage fluids 2 to 3 liters per day. Answer choice C, restrict fluids. D, prepare for dialysis. What do you think about this one? The correct answer is B, encourage fluids 2 to 3 liters per day. Here is the reason why. Increasing fluid intake will help to flush bacteria from the bladder. It will also help to prevent recurrence of cystitis. Answer choice A is not correct because IV pain medication like Demerol is not part of the treatment plan for cystitis. Urinary analgesics are ordered to relieve discomfort. Example is pyridium. Answer choices B and C are opposite of each other. C is not correct. In step 2 of this case study, we found that this patient's symptoms are consistent with cystitis. Dialysis is not the treatment for cystitis, so answer choice D is not correct. In step 5, you will take action. Which of the following nursing actions are appropriate? Select all that apply. Answer choice A, administer prescribed oral antibiotics. B, encourage increased oral fluids. C, teach patient to take bubble baths. D, instruct patient to avoid cranberry juice. Which of them are your choices? Correct answers are A and B. This is the rationale. Antibiotics will be ordered to treat the infection. Increasing oral fluid intake will help to flush out the bacteria from the bladder and prevent recurrence of cystitis. Bubble baths can irritate the urethra, so that should not be encouraged. Answer choice C is not correct. Look at answer choice D. The nurse should not instruct the patient to avoid cranberry juice. Cranberry juice should be encouraged to maintain acidic urine, which will prevent bacterial growth in the bladder. In step 6, we will evaluate outcomes. The nurse started the antibiotics as ordered. After 48 hours of antibiotics, patient updates are shown in the table below. Here are the findings on day 1 and on day 3 for dysuria, temperature, and urine clarity. Here is the question. Is the patient improving? What do you think? Correct answer is yes, the patient is improving. Let's break it down. On day 1, patient has dysuria rated at 8 out of 10 on a pain scale of 0 to 10. And on day 3, the pain is down to 2 out of 10. Normal body temperature is documented on day 3, which is an improvement from 99.3 degrees on day 1. Urine is cloudy on day 1, and on day 3, urine is clear. These are all indications that the treatment plan is effective. Thanks for watching and learning from this video. If you want a more NGN-focused NCLEX prep, our NCLEX prep courses will improve your critical thinking, application, and clinical judgment skills. If you are a repeat test taker, I have a course that is built specifically for you. And if you need remedial course, we are approved by the Florida Board of Nursing. Don't forget to like, share, and subscribe to this channel to stay updated. If you have any questions, you can place them in the comment section. See you next time.